Coming to question number 13, ECG of which of the following inherited metabolic cardiomyopathies with LVH will show ventricular pre-excitation? Is it Fabry's or Friedreich ataxia or Danon disease or MELAS? It's a kind of a good question. The right answer for this question is going to be cardiac Danon disease. So first of all, we need to know something about HCM, hypertrophic cardiomyopathy. What is HCM? It is nothing but unexplained left ventricular hypertrophy, or it could be LVH plus RVH also, but any unexplained left ventricular hypertrophy will be deemed as hypertrophic cardiomyopathy, which means the hypertrophy should not be explained by the loading conditions like valvular problems or probably hypertension, especially if the wall thickness is more than 15 millimeter or 1.5 centimeter. It's very much in favor of diagnosis of hypertrophic cardiomyopathy. And we know hypertrophic cardiomyopathy is of two types. One is sarcomeric HCM, where there will be mutations in the sarcomeric protein genes, and the two most common genes that are involved are going to be myosin heavy chain beta or beta myosin heavy chain and cardiac myosin binding protein C. Okay, these two mutations alone contribute to more than 70% of the cases of identifiable genetic cause of HCM. And second variety is non-sarcomeric HCM. The most important here is going to be Fabry's disease, which is basically due to alpha galactose deficiency. As we all know, it's an X-linked condition. And you have Friedreich ataxia. It's an autosomal recessive condition. And you can get, because of PRKG alpha mutations and LAMP2 gene mutations as well. And some mitochondrial problems also can cause it. There are plenty of other things that can produce non-sarcomeric HCM. And the genetic testing is important in patients' HCM, not just to identify the right gene that is causing HCM, it's also to identify whether it's a sarcomeric HCM or non-sarcomeric HCM. That is because your sarcomeric HCM has a different treatment and natural history, and non-sarcomeric HCM will have a different treatment and a natural history. For example, in Fabry's disease, the treatment is going to be enzyme replacement therapy and follows a completely different natural course to that of sarcomeric HCM. But what you study commonly in textbooks is the sarcomeric HCM. But remember, non-sarcomeric HCM are also very, very important. Even though the proportion of non-sarcomeric HCM patients are limited, but still identifying these patients are very, very crucial because the natural history are different and the treatment is also going to be different. And especially those HCM due to LAMP2 mutations are what we specifically called as Danon disease, cardiac Danon disease, which is also called as glycogen storage disease type 2B. And PRKG mutations and LAMP2 mutations are the ones that are going to be associated with HCM and Wolff-Parkinson-White syndrome, that is ventricular pre-excitation. So that is the reason the right answer for this question is going to be option number C, that is cardiac Danon disease.